So, have you ever imagined why it takes too long for the patient to be admitted in the emergency department? Hello everyone, I'm Leilani, and on this presentation I will go through the reasons for such a delay and explore the circumstances occurring behind the scenes in the emergency department. So in emergency department, patients are admitted for treatment according to the urgency of their medical conditions, regardless of their socioeconomic status. As nurses, we follow certain rules or policies in treating every patient entering in the emergency department. We use patient triage. So in patient triage, we identify patient who can wait from those who cannot wait for the treatment. On this presentation, I will discuss the reasons for such a delay, but for nurses, we call it triaging. So when patient comes in the emergency department, the nurse will assess the patient meticulously and look for any signs of life-threatening injuries. So I will go through the three main points that cause delay in the emergency department. So the first main point is the use of the 5-level triage. So in 5-level triage, the nurse will assess the patient. The nurse will look for any serious or life-threatening injuries, and it will fall under red. These injuries, such as vehicular accident with massive external and internal bleeding, that need to be treated immediately or at least within 2 minutes. And then second level is amber. These are imminent life-threatening injuries that need to be treated within 10 minutes. Example of this is breathing problems. And then third level would be yellow. These are potential life-threatening injuries that need to be treated within 60 minutes. And then under green, these are less severe injuries that can be treated an hour to 2 hours. And then blue, these are simple complaints that can be treated 2 to 4 hours. Then we have the main point number 2, which is another cause of delay for patient, but for us nurses, it is part of the assessment and triage. So we have Maslow's hierarchy of needs. At the very bottom, which is the priority, is the physiological needs. Under this are air, food, warmth, and the rest. And then next is the safety and security needs. The third is the social needs, which refer to the support group. And then fourth will be the self-esteem needs, and last will be the fulfillment. So this is the hierarchy of needs that we have to follow. And then the main point, the third main point would be the use of ABCs. So this is another reason for the delay, but it is part of the patient assessment or triaging. So A stands for airway, B for breathing, and C for circulation. So when we assess, we focus on the ABCs. So if you see yourself in emergency room while waiting to be admitted, probably we are on we are working on one of the main points, so at least you have the you have the information what is happening in the emergency department. So hopefully this presentation help help or explain well what the cause of the delay in the emergency department. So thank you for listening and for your attention.